Pressure compresses gases, so in freediving, it affects your ears, sinuses, mask, and lungs. Water pressure pushes in on these areas and can cause a squeeze, that is, discomfort or pain and injury, if you don't equalize them with the surrounding pressure. To equalize your ears, pinch your nostrils and blow gently. Equalize gently. Never attempt a forceful or extended equalization. Doing so can injure your hearing. Equalize frequently and gently when you feel small pressure changes before you feel discomfort. If you have difficulty, end the dive. See how your ears are doing, and try another dive cautiously. Never continue descending without equalizing. Your sinuses normally equalize as you equalize your ears, but if you feel discomfort in your cheeks and forehead, stop and ascend. To equalize your mask, blow into it through your nose. You can't equalize goggles, so don't freedive to depth wearing goggles. A cold, allergy, or other congestion can make equalizing difficult or impossible, or it can cause a reverse squeeze, difficulty equalizing as you ascend. So never dive with congestion, like from a cold or allergy. With or without congestion, if you ever have signs or symptoms of ear or sinus injury, such as pain or discomfort or bleeding, discontinue freediving and get medical attention. Your lungs are designed to compress, so pressure isn't an issue, provided you start your descents with a full breath. Even so, there's a potential for lung squeeze if you go very deep, something you'll learn more about in the Advanced Freediver course. Lung overexpansion injury is primarily an issue for scuba divers. Even if you're a scuba diver, don't take a breath from scuba at depth while freediving. Even if you remember to exhale, you'll be ascending far faster than is appropriate for scuba divers. Understanding what happens in your body while holding your breath is central to becoming a freediver. When you inhale, muscles in your torso flex, drawing air into your lungs. The air travels through your lungs' air passages to small air sacs called alveoli, surrounded by capillaries. Here, oxygen enters your blood and carbon dioxide exits. Your heart pumps blood from your lungs to the rest of the body, taking oxygen to the tissues and carrying carbon dioxide away. To exhale, your diaphragm relaxes, and your intercostal muscles pull in your rib cage. This decreases your torso volume and air flows out. When you hold your breath, oxygen in your blood, muscles, and lungs declines as your body uses it, and carbon dioxide rises. Your body shifts to processes that don't use oxygen. Immersion and water on your face may trigger the mammalian diving reflex. Your heart slows, conserving oxygen. Blood shifts from the extremities to your core, conserving oxygen for vital systems. Your spleen releases red blood cells, enhancing oxygen transport. Eventually, elevated carbon dioxide, not low oxygen, triggers the urge to breathe. As contractions in your breathing muscles, a burning or bursting sensation in your lungs or throat, or feeling like you need to swallow. Several factors affect how long you can hold your breath. Exertion uses oxygen and produces carbon dioxide, so as a freediver, you learn to relax as much as possible and move efficiently with the least possible stress and effort. The key to extending your breath hold time is learning to relax. Training and practice not only make you more efficient, but helps your body become more tolerant of elevated carbon dioxide and reduced oxygen levels. Though it's important to stay well within your limits as you learn in this course. As you train and practice, your body learns that you can hold your breath much longer than feels possible initially. Digestion uses oxygen and produces carbon dioxide. You need energy to dive, but most freedivers recommend waiting 2 hours after a small meal or 4 after a big one before diving. At one time, it was common to use hyperventilation, a series of deep, rapid breaths, to extend breath hold time. But this is no longer recommended. In fact, it's strongly discouraged in modern freediving. Hyperventilation doesn't put more oxygen in the body, but it does reduce carbon dioxide. Since carbon dioxide stimulates breathing, it may help increased breath hold time, but at a cost. Hyperventilation impairs oxygen uptake in the body. It reduces blood flow to the brain and can cause dizziness, numbness, and tingling. Worse, as you'll see in more detail, it can cause unconsciousness, leading to drowning, and trigger heart attack in predisposed people. And it increases the heart rate, which may mean a shorter breath hold, not longer. Modern freediving uses a period of relaxed breathing prior to descending. Do not use hyperventilation to extend breath hold time. You will learn better, accepted breath hold techniques shortly. The body processes that accommodate breath holding are amazing, but beyond a certain point, LMC, loss of motor control, and blackouts can occur. These are very real freediving risks, so it's important to understand what causes them and how to help a diver who has either. LMC is a series of muscle twitches, convulsions, trembling, and shaking at the surface following apnea. The diver may have unfocused eyes and blue lips and not be responsive. It may be a brief event, or the freediver may become unconscious. Sometimes you hear it called SAMBA. The cause is hypoxia, too little oxygen to support normal body function. Blackout is a loss of consciousness due to hypoxia. Shallow water blackout typically occurs during the last third of an ascent from depth, usually deeper than 10 meters or 30 feet. Often the diver simply blacks out, stops swimming, and exhales. Sometimes the diver blacks out after reaching the surface and taking a few breaths. Shallow water blackouts are associated with hyperventilation. While underwater, body oxygen levels decline, but recall that as you go deeper, you need less oxygen because the body responds to the oxygen pressure. Because hyperventilation depletes carbon dioxide, the urge to breathe is significantly delayed. Oxygen levels continue to fall. The diver finally ascends, and the amount of oxygen required for consciousness rises as the pressure falls. Passing the critical threshold, usually in the last third of the ascent, the diver blacks out. But blackouts can occur on dives that have been entirely shallow and without hyperventilation. Sometimes a diver simply resists the urge to breathe until oxygen levels drop too low to support consciousness. Do not push breath hold durations. LMC and blackouts can be caused by pushing your breath hold durations, even without hyperventilation. As you develop as a freediver, approach your limits progressively so you can always tell where to end a dive within them. To prevent LMC and blackouts, always breathe relaxed. Do not hyperventilate to extend breath hold time. Gain experience slowly. Do not push your durations. After descending to depth, head up well within your limits. Allow ample margin to surface safely. Follow proper breathing practices before, during, and after each breath hold. You'll learn more about these shortly. Always dive with a buddy. Never freedive alone. Always follow established freediving safety practices. We'll cover these in a bit. Always provide assistance to a diver with LMC. Keep the diver face up and support the diver at the surface so the diver can relax, breathe, and recover. Tell the diver to breathe and provide reassurance. Breathe, breathe, I've got you, breathe. The snorkel should be out of the mouth. but if not, remove it. Remove the diver's mask, goggles, or nose clips as necessary. Support the diver clear of the water to allow breathing. LMC events usually pass very quickly, but on rare occasions, the diver may black out. With blackout, the priority is getting the diver's face out of the water. Swim the diver to the surface, ideally face up without tilting the head. This is important because often the victim begins breathing spontaneously upon contact with air. Support the diver at the surface. Discard weight belts if necessary. Begin rescue procedures and signal for help. A diver who doesn't begin breathing requires rescue breathing. Although rare in free-diving blackout cases, if breathing doesn't resume quickly, additional emergency care may be needed. Remove or assist the diver from the water, but continue rescue breaths if the diver isn't yet breathing. Contact emergency medical aid, provide emergency oxygen, and perform CPR if the diver does not have or stops having a heartbeat. We'll go over the steps for this in detail shortly, and you'll practice them with your instructor. It is recommended that you complete CPR, first aid, and oxygen training in the Emergency First Response Primary Care (CPR) and Secondary Care First Aid courses, and the PADI Emergency Oxygen Provider course. Ask your PADI dive center or resort about its schedule for these courses. After an LMC or blackout, regardless of circumstances or how fast the diver recovers, diving ends for the day. A diver who blacked out underwater or who may have inhaled water should have a qualified medical examination, even if apparently fully recovered. Drowning can cause medical complications hours after the incident. These can be fatal, so don't take it or them lightly. In freediving blackouts, it is common for the throat to spasm and close for a very brief period, keeping water out of the lungs. Nonetheless, a qualified physician should determine that water didn't enter the lungs.